If your blood sugar feels high every single morning, even before you've eaten a single bite, there is one 2-minute routine you can do the moment your feet hit the floor. That flattens that spike before breakfast. Welcome back to Ask Nurse Daily. If you check your glucose first thing in the morning and the number is higher than you expect, even on days you ate clean the night before, you are not imagining it. There is a real reason your body does this. Doctors call it the dawn phenomenon. And the good news is emerging research shows you can blunt that spike with a simple 2-minute routine before you even sit down for breakfast. Today I'm going to walk you through that routine exactly the way I teach it to patients managing prediabetes and type 2 diabetes. 3 small movements, 1 small swap, 2 minutes total, done before your coffee. If that sounds useful, hit the subscribe button. We share a new nurse back tip every Tuesday and Friday. Let's start with the very first thing you do. Before your feet even leave the bedroom, drink 16 ounces of plain water. While you sleep, your body dehydrates. This concentrates the sugar in your bloodstream, making your morning glucose look higher than it actually is. Your liver also releases sugar all night to fuel your brain. Water doesn't stop your liver, but it dilutes that sugar concentration. Research shows that simply drinking adequate water in the morning is associated with better glucose control across the entire day. So, place a water bottle on your bedside table tonight. Drink the whole thing tomorrow before your feet touch the floor. No coffee yet, just water. One patient dropped her morning average by 20 points just by adding this one habit. That is the power of going first with water. Once that water is in, move straight into step 2, 60 seconds of slow body weight squats. No gym, no equipment, just 60 seconds. Your thigh muscles are the largest in your body. When they contract, they pull glucose directly out of your bloodstream to use as fuel. The remarkable part? This works independent of insulin. Even if you're insulin resistant, squats still pull sugar out of circulation. Slowly lower yourself for a count of 3, then slowly come back up. Aim for 10 to 15 reps. You're trying to wake up the muscle. One patient dropped his fasting glucose 15 points just by doing squats by his bedpost every morning. That's the power of starting with movement. Step 3 takes about 10 seconds, but it does a lot of heavy lifting. Take 1 tablespoon of apple cider vinegar, mix it into about 8 ounces of water, and drink it down before your meal. Now, most claims are exaggerated, but this one has research behind it. Consuming it before carbs can reduce the blood sugar spike by up to 30%. The acetic acid slows down the rate at which your stomach empties, meaning sugar hits your bloodstream gradually instead of all at once. Buy unfiltered vinegar, the kind with the mother. Always dilute it in water to protect your tooth enamel. Never drink it straight. Drink through a straw if you can, and rinse with plain water afterwards. This is a real evidence-based tip, not a wellness fad. Now for the final step, and this one is less about adding something and more about changing the order of what you already eat. Step 4. When you sit down for breakfast, eat your protein and your fat first. Save the carbohydrates for last. This is one of my favorite pieces of diabetes nurse advice. When you eat carbohydrates on an empty stomach, toast, oatmeal, fruit, juice, that sugar hits your bloodstream very quickly and your glucose spikes hard. But when there is already protein and fat in your stomach when the carbs arrive, your stomach empties more slowly. The carbs get released gradually. Studies on food orders show that simply eating protein and vegetables before carbohydrates can lower the after-meal glucose spike by up to 73%. Same meal, same calories, different order. Here is what to do today. If you usually have toast and eggs, eat the eggs first, all of them, then eat your toast. If you have oatmeal, eat a couple of boiled eggs or a handful of nuts before you start the bowl. One of my favorite stories, a patient of mine ate the exact same breakfast every day: 2 scrambled eggs, 2 slices of whole grain toast, a small glass of orange juice. We changed nothing about what she ate. We just told her to eat the eggs first, the toast second, and sip the juice last. Her after-breakfast glucose readings dropped by an average of 40 points within 1 week. Same food, different order. Now, let's recap your 2-minute morning. 16 ounces of water before your feet touch the floor. 60 seconds of slow squats. 1 tablespoon of apple cider vinegar in water. Then breakfast. Protein and fat first, carbs last. Now I want you to do something for me. Scroll down to the comments and tell me which one of these 4 steps you're going to try first tomorrow morning. Just type the number 1, 2, 3, or 4. I read every single comment and I'll reply to as many as I can. And if this was useful, please subscribe. It's completely free and it tells me to keep making these. A new nurse-backed tip every Tuesday and Friday. This Friday, I'm walking you through the 7 warning signs that your kidneys may be failing and the subtle symptoms most people miss until it's too late. You will not want to miss it. Remember, this channel is for education, not medical advice. Always talk to your own healthcare provider before changing your diet, your exercise, or your medication. Take care of yourself, take care of the people you love, and I'll see you Friday.